Good afternoon, everyone. Thank you for joining the webinar today. We've still got a few people logging in, but I just thought I'd start just a bit of housekeeping initially for me and to introduce the session. So we're here today to talk a little bit around patient privacy, specifically how FairWarning can assist with that, and very kindly been joined by Liverpool Women's to kind of share a little bit about their journey. Just firstly, before I move into the main agenda, just a couple of housekeeping points. Firstly, we are recording the session, so we will be sharing that recording afterwards. So no need to kind of screenshot or jot stuff down. We'll send it through after the session. There's a chat function, so all attendees will remain muted, but there is a chat function. We really would like your questions, comments, feedback throughout, particularly if you've got questions to put to the speakers. I'll be addressing those questions at the end. Also, if there are any issues with the audio or visual, please do let us know via that function. And finally, we will be serving you with a survey once the session ends. So again, we really want your feedback so that we can use that for planning future sessions. So into the agenda and the speakers today. Just very quickly, so that you can all put a face to the voice, I just thought I'd do a quick round of introduction. So I'm Andy Sherritt. I'm here from IT Health. Andy?
Thanks, Andy. I'm Andy Wilcox. I'm the Senior Product Marketing Manager here at Imprivata, looking after our global markets.
I'm Lauren Foster, and I'm the FairWarning Sales Engineer, covering the whole of International for Imprivata.
I'm Amanda McGaffey. I'm the Information Assurance Manager for the Liverpool Women's. I'm the Administrator for FairWarning.
Yeah, also apologies, there's not a photo of me on the intro slide, but I'm Adam Cooper. I'm the International Sales Manager for FairWarning.
Thanks, Adam. Yes, apologies, we didn't get your mugshot up there. But,
yeah,
next time.
Afterwards. Yeah.
I'll blame marketing. Okay, thanks everyone. So very quickly from me, before I kind of pass over to the main speakers, I tend to do this on most of our IT Health webinars, just to explain who IT Health are, first of all. So we're NHS through and through. We're cybersecurity specialists, so we focus on compliance, governance and assurance within healthcare. We've got kind of a range of technologies and services that we offer all around that. And again, a lot of you will be familiar with some of the work we've done over the years. As part of that, we do partner up with a number of different companies and vendors to kind of deliver those solutions. Not inclined to go through all of those for you today, but safe to say we've got a pretty good track record with our own products as well. So the IT Health dashboard is extremely widely deployed, and also our remote access authentication solution, Secure It, has been very popular for a number of years. Obviously, today's session is all around Imprivata, and in particular the kind of FairWarning element of that. IT Health have been Imprivata partners for a long time, so I've been working with them for around about 13 years, I think. And yeah, we've certainly been a predominant NHS partner for them. And again, we've actually got Imprivata in a lot of those customers that we've worked with over the years. So yeah, all of these logos on the screen represent IT Health Imprivata customers, and I guess specifically for today's agenda around patient privacy, the joined up Derbyshire one's quite a recent deployment of that. And obviously we've got Liverpool Women's and Mandy to talk today, who've been a very long-standing Imprivata patient privacy customer with us. So hopefully that's useful and it sets the scene. Once again, please do post your questions in the chat as we move through. I'll be keeping an eye on those and putting them to the relevant speakers at the end. But for now, Andy, I'll pass you the controls.
Thanks, Andy. Thanks for the introduction as well, and setting the scene. And welcome everyone. Thank you for joining today. So yeah, we're going to talk a little bit about the building a culture of trust and privacy within specifically Liverpool Women's, but applicable to any NHS trust. And I wanted to just set a little bit of scene as to around our FairWarning product, which Andy's already mentioned, which is very focused on delivering that that output, that end user benefit. And oh, Andy, I don't seem to have control.
You just might need to sorry. Let me try that again. That seems to have failed.
I love it when a technical gremlin comes along.
Oh, I'm just testing you a bit. Try now, Andy.
There we go. Good to go. Yeah. So where was I? Yeah. So FairWarning is actually part of a broader collection of solutions that form our digital identity platform. And really, when we're talking about digital identity or a digital identity platform, there are a few different elements that we're looking to address. And that's about, firstly, enabling users, enabling their access to systems, being able to control what they have access to, and then being able to monitor what they're doing. And really what we're trying to do there is to improve access for our end users, make it easier, simpler to access the technology we want them to use, to improve our cybersecurity posture so that we're protecting all of that data and that we know who's accessing what and where. And ultimately, that's leading to a better level of compliance that we can demonstrate to NHS central bodies, to whoever we need to around things like IG SOC and, IG Statement of Compliance is old. I mean, DSPT these days, GDPR, things that we know we need to be compliant with. And really, when we sort of, where are we gone there? When we're talking about this kind of digital identity piece, there are three main components that I said we're trying to address. And when we look at it, we want to be looking at digital identity in a very kind of unified manner in the organization. So firstly, if we think about access, it's about enabling users to have access to all of those systems quickly and easily and efficiently, being able to access critical resources, whether they're local users or whether they're privileged users that we want to grant access to temporarily for whatever reason, and ensuring that they've got access across all of the devices and elements they need. And then on the cybersecurity side, it's about controlling what users can do once they're in our system. So role-based access control, ensuring that they're provisioned into the right systems, that they have the right level of access. And then finally, and in some ways most importantly, the piece that we're going to be talking about today, which is about how we ensure that when we've granted all this access and given all these permissions, that users are using it effectively and within the constraints of what we want them to do or what they're allowed to do, so that they're making sure that they're only looking at the records they need to, only accessing the systems they need to when they need to use them, and ensuring that that's, we've got all of the audit logs, we've got all of the tracking to support that and to support our diligence and governance in operating as an organization. So we're talking about FairWarning today, which is part of a broad range of suite of tools, solutions that Imprivata has that fit all of these different areas that digital identity touches. And this on screen is our framework. And FairWarning is very much focused on that governance and administration, that the policy management and the access management element, and ensuring that people are doing what they should be doing. And actually, FairWarning is part of a suite of products that all talk together. So that's the nice thing about a platform, is they're not solutions in isolation. They all talk together. And one sign which many of you will have heard of is our single sign-on and access management product, often where people start their journey with Imprivata. And that's understandable because that deals with that access piece. But as we go around all of the other products, we have solutions that manage the joiner mover leaver process, that manage things like multi-factor authentication, deal with mobile access, and specifically FairWarning. And where the benefit for FairWarning is in terms of linking with one side is being able to see who's logged into not just Windows and application, but applications as well. So using in effect one ID, as we call it, we can monitor and track users' behavior across all of their interactions within our healthcare IT environment. And that's really fundamental. And that's why having a platform of identity solutions is really, really powerful in managing your identity estate in a much more unified manner. So that's kind of a little introduction that I wanted to do. I'm going to hand over to Adam now, who's actually going to talk a little bit more about the FairWarning in detail before we move on to a demo. So Adam, are you ready to go?
Thanks, Andy. Yeah.
Over to you.
Have I got control? Andy, have you
Sorry,
passed control over? Yes, all right.
It'll be yours in one moment. There you go. You should be good.
Great. So as Andy was just saying, I've got some slides just to give you an overview of FairWarning before we go into the actual solution presentation itself. And this first slide, I mean, the messaging on it is familiar to, I think, probably everybody that's on this call. What we've seen is this massive increase in the usage of electronic health records and other electronic methods of healthcare delivery. And all that is creating significant data security and compliance challenges. Millions of rows of data are being produced every single day in every organization, and security and compliance teams are having to spend a great deal of time to investigate any potential data breaches or security incidents. And it's well known that data breaches don't only come from outside of your organization, you know, whether it's from unintentional negligence or intentional malicious behavior. Insider threat is a very serious risk in healthcare. And these insider threats, we've listed a few of them there. We're going to go into a bit more detail later in the presentation, but these insider threats can take many forms: unauthorized access, employee snooping, data theft. And we've listed one recent example. In fact, up in Scotland, the whole of Scotland is one of our existing FairWarning customers. But we had an incident at NHS Lothian where the medical records of over 150 staff members were inappropriately accessed by a staff member at the Edinburgh Royal Hospital. And it was actually FairWarning that was responsible for alerting that particular breach. So just tying back in onto the digital identity framework, and Andy, you saw the suite of products we have there, and all of that complexity has exposed the need for a very robust digital identity strategy. And a lot of the products we've got within our digital identity framework are controlling, you know, how users access systems, where they access them from, who can access those systems. But FairWarning is going beyond that. A really important part of your digital identity strategy is monitoring and managing what users are doing once they're inside the application, what they're doing with PHI and other data that they access. Are they using it in an approved, secure and compliant way? And without a tool to help you, finding those potential instances of inappropriate access is really hard. It's a very hard thing to do. So, and what we see for that reason, many healthcare organizations are only being able to react to those. So they're behaving in a reactive way to any reported instance of inappropriate activity. And that process, the subsequent manual audits that take place, are extremely time consuming. They could involve engaging multiple different system owners. The output from all those different systems is often inconsistent, makes those results very hard to analyze, especially if individuals aren't overly familiar with those systems as well. And so that's where, you know, FairWarning solutions will come in. We've got solutions that will automate the monitoring of data based on pre-agreed preset policies, allowing you to quickly identify any anomalous behavior within those applications for you then to potentially investigate. Systems include EMRs or any other clinical applications which are monitoring interactions with PHI and patient data. There's actually two solutions on the screen here. FairWarning can also integrate with cloud applications such as Salesforce and Microsoft Office 365 to apply a similar data monitoring to sensitive corporate data, but today we're just focusing on the PPI side. And here on this slide, we've shown some examples of some of the systems we are already integrating with. In fact, the list of clinical systems we've already got pre-built integrations with, it runs into the hundreds. We can share a link with all those systems. But it doesn't matter if it's a brand new system as well. We've got, you know, experience, expertise to help you as part of that project. What you'll see are some very well-known names, some of the big EMR vendors like Cerner and Epic. But again, we work with lots of smaller niche systems. What we typically see within the NHS is we might be working with one customer and we're only bringing in one data source. You know, if, for example, they're a big Cerner customer. In other occasions, we might have a trust that's gone down the best of breed approach. So we might be bringing in 6 different systems as clinical data sources. And what FairWarning is helping you do is make better sense of all that data that we're bringing in so that you can then take meaningful, actionable steps and as near to real time as possible. We've listed some of the benefits there on this slide. So in addition to reducing risk, improving security, meeting compliance requirements, it's also helping you as an organization be more efficient and effective. And as a result of that, you can establish a culture of trust in your organization by driving out any potential bad behavior. You can also be more effectively tailoring onboarding of new staff members or training programs, again, within your organization. Just ensuring that all staff members are aware of their responsibilities with regards to protecting patient privacy. What we've seen is, again, with some of our customers, organizations can proactively identify particular departments where additional training might be required. Perhaps it's a department with higher levels of staff turnover, but again, just helping you to ultimately build that culture of privacy, of trust in the organization. And that's something, in fact, we're going to, go into a bit further when we get to speak with Mandy at Liverpool Women's. So how does FairWarning work? So step 1, a user performs an action inside of your EMR, like, for example, looking at test results or printing a document. What that action does is it then generates an activity audit log that's stored within your EMR's database. Daily, a subset of these logs are extracted and fed into the FairWarning platform, where the data then undergoes a series of transformations so that that data is then able to be queried and visualized in easy to interpret format. You'll see the demo in a moment, but again, we've designed the system to be used not by IT users, but by business users, by people working in the IT departments, people that are answering those queries from members of the public, for example. Also then, criteria-based reports can be set up to run automatically against your data and then provide system-generated alerts should those criteria be met. We refer to those as enforced policies. Again, we'll show you that in a second. You can also run reports on an ad hoc basis as well to produce one-off results, something, again, a tool called Quick Report we'll show you in a second. A good example of that, of course, is if a member of the public called into your IG office accusing a member of staff of inappropriately accessing the records, and we'll show you that in just a moment. So just my last slide before I hand over to Lauren, we're just listing some of the use cases for FairWarning, and we split these into 2 categories. So we've got known risks and unknown risks. And what we mean by known risks are things that most organizations realize are probably happening on a daily basis within their organization. So some of them are perhaps lower level from a security perspective, but some are a lot more serious as well. Starting at the top of that list, snooping. So people looking at their own record, in fact, but looking at co-workers' records, neighbors' records, VIP patients, obviously an obvious one as well. Quite often when we're working with a new customer, we start with something like a co-worker snooping alert, because it's quite prevalent. You might see results fairly quickly from it, and again, it's very good tool to use then to spread that message internally inside your organization. It's not something that a staff member would typically get fired for on their first occurrence, but it's something that then starts to get that message out. Moving down that list, inappropriate record modification, people going in and changing anything within a record, cancelling or editing something without permission or a legitimate reason to do so. Next, data exfiltration. Again, are people exporting data out of your system for any reason, maybe could be for fraud or identity theft reasons even. The next one is access by terminated users. I'm always amazed by how many people, once they've left an organization, can still access systems. So again, that's something that FairWarning can be helping you monitor proactively. inside the solution, and then compromised credentials. So perhaps credentials have been stolen, or perhaps they've been duplicated and being misused. So again, something we can monitor. And then moving on to the unknown risk side. And so here what we're talking about are things that wouldn't be so easy to spot, certainly by an individual looking through a spreadsheet. Again, FairWarning as a company has been around since 2005, so we've got years of experience and expertise. There's machine learning and AI built into the platform to be monitoring, to be plowing through those huge levels of data to a level that an individual just couldn't, and looking for some of these, these more difficult to spot risks or anomalous behaviours. The first one here is a very relevant one, I think, at the moment. There is a normal workflow. So somebody behaving outside of normal behavior patterns, that could be their own, or it could be of their peers. So for example, is somebody viewing a lot more records all of a sudden, or printing off a lot more records, or exporting that data. Next one is accessed by a non-care team. It could be somebody working in the same department a patient's being treated in, but they're not part of that particular person's care team. Similarly, then access from another department, somebody looking at record, perhaps somebody's recognized somebody coming into the hospital and quickly look them up. And then the last one there is inappropriate access by affiliates or third parties, so external access, for example. So I'm going to hand over at this point to Lauren, who'll give you a solution overview ahead of them when we get the chance to speak with Mandy from Liverpool Women. So Lauren, over to you.
Thank you very much. I'm just going to share out my window now.
Yeah, we can see that, Lauren. Thank you.
Yeah, I was just making sure I was on the right one there. Fabulous. So we're going to go a quick walk through of the FairWarning application today, show you a bit of how it works and some of the workflows that we've put into the application. So as we've already discussed, what the FairWarning Patient Privacy Intelligence platform is doing is it's giving you the means to really understand exactly what your authenticated users are doing once they're logged into your clinical systems. So we ingest those user activity logs from either a single clinical system or multiple different clinical systems. And then on top of that, we layer on data from HR systems such as ESR. This then combines all the data together to provide that really complete understanding of both users and their actions in one single pane of glass. So the first way that we can tap into that really centralized data feed is by utilizing the quick report feature. And the quick report is allowing you to easily query all of those different activity logs from all of those different clinical systems that are being fed into the FairWarning application. So like that example of a patient complaint. We'll use that example here and say that we had a patient call into our governance department stating that they'd been in hospital and they feel like their medical record may have been inappropriately accessed. To run these, you need a start date and an end date for their time in hospital, either some user information or some patient information, or even a combination of the two to make it even more specific. So by hitting execute, FairWarning is going and it's looking through that whole repository of data sitting inside the application, and then it presents the data for us here in a nice, easy to interpret format. Adam mentioned the application's aimed at business-minded users, members of the Information Governance Department, so we want the data really set up to tell a story to gain as much intelligence from it as possible. One really nice thing is that all of the output from all of the clinical systems is presented to you in one place. So here we've got data coming from Epic and Athena, accesses inside those two clinical systems, but all of the data is presented under unified field headers, making it nice and easy to read. They tell you when something happened, where it happened, who performed that activity. By layering on that HR data, you get further information about these individuals, the departments they work in, their titles. Then you get information on exactly what happened. So first of all, what type of activity have they performed? Have they viewed something, updated it, deleted it? And what did they do? So in this case, we can see that this individual's performed view-only activity, they've looked at this medical record, and they've viewed a diagnosis. And they've done that on the patient in question who called up our department, John Smithson. We then get to see the information about him as well, the department that he belonged to, and also his birth date. His birth date provides us with something really interesting. We can see here that he was born in 1977, so he's an adult patient. but he's actually being accessed by a member of the paediatrics department. So by having all of that information about our patients, the access and our users, we can clearly see here, can't really find a business reason why someone from paediatrics is accessing an adult surgical patient. So we would need to go ahead and investigate this access a little bit further and understand why that happened. Now we could do that in the application, utilising the investigation module that we'll go through at the end. Or all of this data can be exported from the application as well, and then uploaded into your incident management tool, be it Datix or be it another one. You can take all of the data out to then utilise it how you want to in your organisation. So this example here shows the reactive way in which FairWarning can currently help in an organisation, how we can streamline that reactive workflow. But really what the bread and butter of the platform is proactively alerting on these potential suspicious activities that are happening in your organisation. And out of the box, the application comes with an entire report library. A report library of all sorts of different use cases that you can monitor for in your organisation. For example, individuals accessing medical records after hours, looking at the medical records of people in the same household, or even their co-workers. All of these reports can be customised to fit your requirements. They can be ran one-off, if you just want a point in time, has this type of activity happened? Or what we tend to do with a lot of these is schedule these reports to run proactively. So you want FairWarning on a set cadence to go and look for this type of activity happening on your data. And when we do that, when we schedule it to run at a set time, be it daily, weekly, or monthly, that's when we turn it into what's called an enforced policy or a scheduled report. These enforced policies will then provide you with proactive alerts. They can come in the form of emails, they can go to individuals, they can go to dedicated groups, or they can sit inside the platform and they let you know they found a scenario, you need to come in and you need to review that and decide if it is actually inappropriate or not. So this is an example of potential co-worker snooping that the FairWarning application's found. Every alert has an ID, allowing you to keep track of them, keep everything uniform, lets you know who owns it and who's been involved in this alert. You can see the patient in question here and the user in question. Now we can go in and have a look at this alert and see exactly what FairWarning has found and what information it's presenting us with to help make a decision on this access. Alerts are a lot more comprehensive than just running a standard report. In addition to getting the alert events, you get a lot more information. So we'll always tell you exactly what we've found, exactly who's involved, with all of the information that we have about the individuals. You can also collaborate inside these alerts. You can collaborate with different members of the governance team, or you can utilise the role-based access of the platform to collaborate with other departments, should that be something that you would like to do. So initially, just like running a normal report, you get the alert events. What's FairWarning found that's triggered this alert? It's found that on the day in question, this individual who works in the surgery department, this is their title. They have looked up and viewed a patient's medical records, including their diagnosis information, and they've performed that on this patient. And what the system has deemed is that the patient in question is also a co-worker of the person who looked at their medical records. They work in the same department. And here we can see that this patient was a patient in both the emergency services and the psychiatric services department. So straight away, we're going to have some questions. Why is a co-worker looking at their colleague's medical records? And also, they don't work in the same department that the patient was in the first place. So why is that access happening? One thing we focus a lot with FairWarning is workflow. We want to make it easy and we want to make getting to the resolution as quick and as seamless as possible. So one of the newest additions to the platform is what we call our automated incident response reports. That's a mouthful. I call it a bit of supplementary analysis, what will help you get to your decision quicker. Questions such as, okay, I'm a bit in question about why someone from this department is accessing the patient. So I wonder what other departments have actually accessed this patient's medical record over their time in hospital as well. You can see we've got members from Psych Med, like we would expect for this type of patient, Psych Lab, again, what we would expect. but only one individual from the surgery department has access to this person's medical records, and we know that that's our co-worker in question. You can see this in both the graph format, or we can come down and see the details as well, where we can drill in more and see the actual individuals who have been accessing this patient. So what I'm trying to do is go through and really find a way to legitimise this access. I couldn't do it by looking at the departments. I know the co-worker viewed the diagnosis information. We can also go and see, is that typical behaviour for this individual in question? They typically look up patients and view the charts, but actually viewing diagnosis information isn't typical behaviour for this individual in question. These reports at the top here, they are customisable both by scenario that you're looking for and by your organisation's requirements. So if you typically ask a certain question when reviewing a certain policy, you can also build that question in here to again streamline that workflow and mean that you don't have to move around the platform as much, and all the information is there for you to make your decision. Once you've decided if you want to either dismiss this alert or investigate it further, again, you could take all of this information out of the platform, including these additional reports. It will all come out together. Or you can utilise the inbuilt investigation module that sits within FairWarning. If you chose to do that, our investigations look a little something like this. It's a very comprehensive portion of the platform, and what we really want to do is assist with standardising and centralising all of these incidents, keeping them all inside FairWarning and keeping everything together. Investigations can benefit from using standard naming conventions that we can actually pre-populate off the back of these enforced policies. Same with the description, so everything gets a standard description depending on the type of policy that you're investigating against. We can give everything a risk score, and we can also toggle if that's going to be reportable or not, so you know what you're going to have to do if you do conclude that this is a true incident. We document where this incident happened. For FairWarning generated alerts, that's always going to be from the EMR. However, you can use this portion of the platform to document more than just FairWarning investigations. It can be any type of incident related to data privacy. For example, any paper medical records that may have been lost and then located, emails that have went to the wrong distribution list, potentially containing PII. You could log all of these inside FairWarning as well. Again, it's a collaborative portion of the platform, so you can give access to other departments on a very lightweight access to allow them to come in and add their knowledge to this investigation. In addition to that, you can centralise all documentation related to the incident inside FairWarning via email chains or memorandums, and the alert details themselves. You can keep them all inside this investigation. And then we can document the resolution, allowing us to know what came off of this. Was it an incident or was it not? Potentially then what department that linked back to, so we can start to see a trend in a particular part of the organisation. And we can keep track of exactly how we're dealing with these incidents. What are we doing with the employees? How are we retraining them and trying to educate them further on their responsibilities and what is appropriate and what isn't? Very comprehensive portion of the platform, and it does drive some other features within the application as well. Next bit we'll move into is the very newest portion of the FairWarning application, and like Andy mentioned, that is the One ID. This is where we really make use of information that we do gain from the OneSign logs to power that identity intelligence. Apologies, it's just taking a little second. I knew I wasn't going to get through a full demo without some sort of technical gremlin. Here we go. So the One ID is really a reimagining of the old FairWarning people card. And it's that top-down analysis across monitored applications inside your organisation. So we can see that longitudinal view of your users. For example, what alerts have they been involved in, if any? What systems are they accessing? And their activities throughout different applications. So we can see all of that consolidated information about a person. What did they then have access to? When have they last accessed it? And all of their activity. This combined together can give individuals a risk score. So therefore, if you're investigating an individual, you can see very clearly, have they been investigated before? Have they been involved in an incident before? Or if this is their first time, and understand from the investigations, potentially what education they have already had in order to enable them to understand more of their responsibilities. So the last piece that we'll go into is the FairWarning governance section, and this really ties it all together. So the governance section comes with another inbuilt report library, but what these reports show is information about your FairWarning program. For example, how many alerts are you generating from your enforced policies? Out of them, what are you then investigating and what ones are turning out to be true incidents? So you can understand the quality of your alerts. If you're utilising our machine learning or behavioural correlations, how effective has that been for you and how much workload is that taking down for you? Again, all of these can be ran ad hoc if you want a snapshot of that information. Or what typically happens with reporting like this is we like to build it into a centralised view, so we'll utilise our dashboard. For example, the types of questions that typically get asked at IG boards or CSIRO boards, we'll want to build all of those questions together so we've got easy access to that information and start to gain a bit of an organisational understanding. Examples, this is a very good example, and it's a very typical example of what we see a graph looking like for an organisation that newly deploys FairWarning. So this is all the investigations that have closed with a true incident over a certain time period. So we'll see we'll be at a standard number, potentially be at 0 if there's no proactive monitoring going on. And then when you start looking for things, you'll find them. But at the same time as finding these incidents, you'll be educating the workforce, sending out screenshots, doing trainings, and people will be constantly hearing about the fact that their actions are being monitored inside these applications. Word of mouth will also start to take hold as well if somebody does go through potentially a bit of a disciplinary regarding an access that they've done recently. That starts to work together and we try and drive this down. So word of mouth and education really take hold. You're a bit more informed about where these incidents are coming from by utilising the investigations. You can again narrow it down to a department, potentially understand if they have a bit of a higher turnover than another part of your organisation. And it will ebb and it will flow as time will go on. Things will happen, priorities will change. But with FairWarning, giving you that understanding of what's happening, who's doing it, how we're dealing with it, we can really tailor our education programs to make sure that we're catching people as quick as possible and then really educating people on their responsibilities when it comes to data privacy and how they act inside these EMRs. And that is the walkthrough of FairWarning. I think I'm handing it back to Adam.
Thanks, Lauren. That was excellent. I'll just take the screen sharing back off you. Bear with me a moment.
Okay.
Monitor. Okay. And Andy, do you want to take back control?
It's going to be me actually, Andy. Adam. So you pass it to me, please.
Yeah. My machine's going a bit slow, but I'll be with you in a moment. Okay, you should actually have keyboard and mouse now.
There we go. Yeah. Okay. Yeah. And just one comment that's worth mentioning. So that was just intended. The demonstration there was just intended as a high-level overview. Of course, we'd be very happy to arrange for a more in-depth session with any organisation. So, you know, please reach out to us directly afterwards if that would be of interest. So this next point apart, we're going to be getting the opportunity to speak with Mandy from Liverpool Women's, but I thought I'd just give a quick intro to Liverpool Women's NHS Foundation Trust before that. As many as you know, it's a specialist hospital. It specialises in the health of women and their babies, both within the hospital and out in the community as well. It's actually unique. It's the only such specialist trust in the UK and the largest women's hospital of its kind, 2,000 employees and serving a community of 50,000 patients. Main hospitals in Toxteth, and around 8,500 babies are delivered each year. I've done the maths for you. That's an average of 23 babies born every single day, and 10,000 gynecological procedures are performed there annually as well. One other big area for them is clinical research. It's a pioneering centre for fertility help and gynecology, oncology as well. It's also works very closely with the University of Liverpool in its role as a teaching hospital as well. So you can see how, as a leading institution, patient confidentiality and privacy are such a top priority for them. Mandy, again, thank you very much for agreeing to be part of this session today. I know I've worked with the NHS in IT perspective for getting on for 20 years. I know how useful it is for NHS organisations to be able to speak with each other. So if anybody does have any questions they'd like to ask Mandy, then please drop them into the chat. But the first question we've got is, how long have you been using FairWarning solution for, and how did you come to be responsible for the application, Mandy?
It was originally bought in 2013 by our IM&T department, and then it came over to information governance about 6 months later. IT didn't switch it on, but they handed it to us to start with the monitoring inappropriate access. So we've had it, I think we're coming up to 10 years.
Yeah, it will be, yeah. That in fact, in the UK, that makes you our longest standing customer. So next question. So what did you think have been the key benefits to Liverpool Women's from using FairWarning?
It helps us provide assurance that the inappropriate access isn't happening. It's also, what we didn't know was one of the benefits is you do get malicious calls from the public saying that they think a member of staff have access to records, and with FairWarning we could support the staff and prove that the staff hadn't done the inappropriate access. It gives us assurance for our DSP toolkit, our ISO 27001. It's all GDPR, it's all data protection, it's active monitoring rather than audits, finding the events before they happen. We're preventing, it's preventative rather than reactive. I think that really covers the benefits of it. It's
Sure.
basically our data protection tool for information governance.
Yeah, in fact, it's an interesting point you raised just about protecting the staff, because I think sometimes, again, when we're having conversations with customers, sometimes feel this is, almost a tool to catch people out. I'm one of those people that doesn't like my finger being pointed at me. You walk through the green section at the airport and I always feel guilty, but I'm glad that green section's there. I'm glad there's people in there, looking for anybody that might be going through. But I think it's a good point. It's there to protect everybody. We're all consumers of healthcare. Our family are as well. It's not there just to be spotting anomalous behaviour. It's there to protect people. So if there are malicious complaints, for example, I know when we've spoken in the past, you've said how quickly you can deal with those complaints. It's almost while somebody's on the phone to you can, FairWarning is that quick that you can go in, log into the system, and whilst you're having a conversation with somebody, see that in fact there wasn't anything untoward happening. There weren't any anomalies. So close that call down almost as quickly as that. So yeah, it's an interesting point.
The data's refreshed pretty quickly. It's like every 24 hours. So we can easily check there and then and close any types of requests like that.
Yeah, so just leading on from that, the next question, so from an information governance stance, how has FairWarning aided you and your team from an investigations and compliance perspective? I mean, perhaps here, share a bit about, how the process would be working manually if you didn't have FairWarning.
Before FairWarning, most of our investigations, the reactive, from complaints, will have to get output logs from the systems. We've got to manually run through all the audit trails, and obviously, as like any other NHS hospital, we don't have one system. So with FairWarning, the reports are there, the reports stay there. We just search the user or the patient, and we can see exactly what system was used. We can see when, we can see who by. So the amount of time the proactive reporting saves us was unreal.
Brilliant. Yeah.
And also because once we told the staff we were running FairWarning, we obviously don't get any anymore.
Yeah, And again, you're saying that you bring in, a number of different clinical systems, but again, what we find with our customers is you don't, and in fact, this is leading on to the next question, but you don't socialize necessarily which systems are being monitored, because if there might be some systems you're not, there might be smaller systems, but people don't need to know that. You just need to know that there's a system in place that is there monitoring behavior. So yeah, this next question is something again we get asked all the time, but how do you socialize this type of monitoring to the staff at the hospital so that it isn't perceived as a big brother approach to catch people out?
Well, we do tell them it's also a protective tool, and we can see what they're looking at, but we're only looking at what they're looking at if it is for their own benefit, and it is obviously for the patient's benefit. We communicate through on all of our systems. As soon as you log into one of the systems, there's a pop-up to say the system is actively monitored. We deliver it to all new staff on corporate induction and mandatory training. We inform them that we have FairWarning, and it is a proactive monitoring system. And communication emails as well, we send them round monthly just to remind staff that it is always running in the background. And at any point, if you do access something, because people can accidentally put in a number and it'll pop up and it just so happens it's someone they can contact us and tell us, and we can check through the logs, and you can see when there's been a mistake. The numbers will be similar to either the previous or the patients they were supposed to access afterwards. So it's ensuring them that the investigations, if they pop up on any of these FairWarning reports, the processes are in place to completely eliminate the reasons why they accessed, rather than pointing the finger straight away.
Sure. In fact, it's worth mentioning another point that you were saying about it's running in the background, but in fact, again, you mentioned it earlier about this daily feed from the systems. With FairWarning, what we've always done is make sure it's never getting in the way of anybody's access to that patient information that's needed for clinical care. It's a daily push, and it happens, at a pre-agreed time, but maybe it's 2 o'clock in the morning. It's not. We're never going into those systems directly. It's information is being pushed from those systems. So, as I say, just to make sure that there's never any obstacle to the way of that data being made available for someone's care. And in fact, you mentioned at the beginning you've been a customer for nearly 10 years, and this question might seem a bit of a strange one. What are the biggest challenges in implementing FairWarning? But in fact, it's very pertinent, because at Liverpool Women's, of course, at the moment, you're going through a project with us for the move from an on-prem solution, which used to be the approach for FairWarning, to now to the SaaS environment. So everybody now is moving across to SaaS, or any new customers, of course, already starting out that way. So is there anything you might want to mention around that process implementation side, or any challenges to be aware of?
We've got a pretty good project team with FairWarning. So many questions they've answered. It's basically just making sure us on our end have got the right stakeholders involved. We've got any of our third-party IT people, any of our on-site IT people, anyone who needs to be there are there. So they're sort of the only challenges, is getting everyone in the same room. But there's no, as far as I'm aware, we've got no actual issues technically to prevent us from putting it in. It's just making sure everyone's there who should be there.
Sure. Yeah, and again, what we quite often find working with new customers is, you just mentioned it yourself, bringing in those stakeholders early, or even ahead of us, reaching agreement with an organization. If there's things like security assessment forms that need completing as a SaaS solution, or cloud assessment forms, then we can do those as part of the sales process ahead of the project side as well. So
yeah.
And then the last question, it's oh, is it loading? A bit of a, have I still got control?
Yes, it's just popped up.
Oh, there we go. Sorry, the last question. Yeah, it's a bit of a loaded question, but do you think FairWarning has helped Liverpool Women's establish a culture of trust?
Yeah, I do believe it has. It's as I said, we haven't had any inappropriate access of records for over 4 years now. Brilliant. So there's a culture within the organisation that it doesn't happen. We are watching. We're watching. you know, that we're there to support if there's any malicious comments. So I think there's a lot of trust in the tool because people are, no one's inappropriately accessing records anymore.
Yeah. I think one really brilliant piece of evidence of that as well is, and I won't go into names or organisations, but we did have a very senior person at Liverpool Women's move to another organisation and then make sure that they also bought FairWarning. So yeah, I think that's brilliant evidence of that.
Yeah.
So thank you again, Mandy. As I say, that was you know, we very much appreciate you being part of this session. So Andy, if I hand back to you, I don't know if there's been any questions come in during.
Yeah, we have had one question. Just to say, everyone, there is still time to post your questions if you haven't done already. But the one that I have got here was just, I guess this is going to be quite a difficult one to answer, but I'll put it to the panel anyway. How much staff input is needed to review the reports?
There's only me. I'm the information assurance manager, so FairWarning isn't my main job. The way FairWarning's set up is it can show you alerts. Depending on what version of FairWarning you've got, it will sort of, Andy, correct me if I'm wrong, it can, after a certain amount of time of run reports, it can automatically find trends of who should be accessing what, and they'll drop off, so you'll stop getting them. So the more advanced the system becomes, the less amount of alerts you will get. But the more you use FairWarning, you'll see alerts and you close them down quickly. So
Yeah.
I tend to spend probably a couple of hours a week just reviewing alerts.
Okay, well that's a decent answer, thank you. And obviously you kind of hit the key point just before that as well, which was that the idea is kind of not to catch people, but to actually drive down the activity at the end of the day, which it sounds like it's helped you to achieve. So yeah, I've got a couple more questions, thank you. How did you avoid wasting time on false positives?
It's the trends. You notice the trends, you become aware of the patient's care pathway. So you'll get one patient on a care pathway and then you'll see everyone who's accessed it. But because you work in the organisation, you know what pathway you're looking at. So for example, if we had a maternity patient and then we had one of the genetics people coming in, that would raise alerts, but there's a chance that patient could have had a genetics test at some point. So you'd expect a maternity patient to go through a care pathway of antenatal, maternity, and then postnatal. So anyone accessing through that route would be fine.
Yeah, that makes sense. Okay.
Yeah,
Sorry, I've got a lot of background
Andy,
noise in the office.
It's fine. It's not coming through actually, so
Okay.
The audio is fine, Mandy. But yeah, and some of that, Andy, of course, is also around the system, the knowledge and the machine learning running in the background of the system, and that's something that is always being continually enhanced as well. Another benefit of FairWarning now being a SaaS solution is customers are always on the latest version. So anytime there's any enhancements to the solution, they get them. But yeah, an awful lot of that is around improving those alerts, making sure that people aren't ending up with too many to even go through. So yeah, it's one of the big benefits of the platform.
I've got another question, thank you. Probably one for you, Adam. Is this easier to use in a smaller organisation? What is the size of the largest organisation that has this solution?
Yeah, very much so. It's in fact we price it by organization size and by number of data sources. So if you're a smaller organization, you pay a lesser amount. But yeah, we've got customers that are single hospitals. It could be very small organizations. There's no lower limit to it, right up to entire countries. In the case of Scotland, for example. We've also as well picked up recently Joined Up Care Derbyshire as a customer, which is one of the first ICS customers we've got now with their summary care record. But yeah, there isn't a lower limit, and equally there isn't an upper limit. We've got examples of people of organisations right across the spectrum.
Yeah, agreed. Yeah, so IT Health have been working with FairWarning for many years, and yeah, we've seen it installed at some of the largest acutes, not just in the UK, but across the world as well. So yeah, happy to talk to you a bit further about that if there's any more questions. I think that's it for now. Apologies if I have missed any. Obviously we'll get we're just about, when I close the webinar down, you should receive the survey straight away. So if you could just fill that in, if there's any further information needed, or yeah, request for follow-up information or costs, that's absolutely fine. Just put that in there and we'll be in touch very shortly. But I believe that brings us to a close. Thank you to all of our speakers, especially Mandy, for taking the time to explain, and thanks everyone for joining. We'll see you soon.
Thanks everybody. Take care.
Thanks, everyone.
Thank you.
Thank
Bye.
you. Bye.